Good afternoon, everyone, and welcome. And thank you for joining us for this quite interesting discussion about the 2020 election at the federal level and the implications that those elections will have in Puerto Rico's healthcare system. As many of you may know, we have a very talented group of panelists today. I'm Luis Fortuño, a former governor of Puerto Rico and currently a partner at Step 2 and Johnson in the DC office. And before we have MAPA's president, Bobby Garcia, offer us some welcoming remarks, I want to give you a brief overview of today's program. Bobby will commence today and give us a welcome, and then we'll have different speakers that will be talking about the election and the results and the effects that will have on Puerto Rico's healthcare system. And afterwards, I urge everyone to stay on for a Q&A session, and we will try to address as many of your questions as possible. You will see in your screens a feature that actually will allow you to send us your questions, and we'll try to address them as best as possible. With that, I'd like to hand it over to Bobby Garcia, who will welcome us for today's session.
Okay, well, thank you for that, Roberto. That helps to take the mute button off. So good afternoon, everyone, and thank you, Governor Fortuño, for the introduction. I am the president of MAPA this year, of the Medicaid and Medicare Advantage Products Association. We have taken turns amongst us in presiding this organization, so it is an honor and a pleasure to be at the helm this year, taking my turn. I want to thank you all for taking the time to join us today. As many of you know, MAPA is a nonprofit organization that's composed of the leading Medicaid and Medicare Advantage organizations in Puerto Rico. We're all now members of this organization: First Medical, Humana, MCS, MMM, Plan de Salud Menonita, and Triple S as well. I'd like to take the opportunity to acknowledge my fellow members of the MAPA board who've done tremendous work and been tremendous partners in the effort to advance the Puerto Rican healthcare system over these many years. Specifically, Juan Dominguez, Vice President of First Medical, Luis Torres, President of Humana, Jim Drobanek, CEO and Chairman of MCS, and Dr. Rick Shinto, CEO of MMM. Our organization advocates for increased federal investment in the Puerto Rican healthcare system, and we all know how critical that is, right? Now more than ever for policymakers in Washington to understand the needs of patients and providers on the island. We also strive as an organization to be a resource for stakeholders in Puerto Rico, and in this spirit, we brought together a panel of leading political and health policy experts, including representatives from MAPA member companies, to provide a briefing on the outcome of the 2020 federal elections and the implications for Puerto Rico healthcare. I'm very pleased to have you, Governor Fortuño, here to moderate the discussion. Governor Fortuño is joined by Andrew McKechnie, a partner at Peck Madigan Jones, and Charlotte Evanchik, partner at Tarplin, Downs & Young. The three of them will walk us through what we can expect from the incoming Biden administration, as well as what the election means for health and funding legislation in the House and the Senate. Orlando Gonzalez of MMM and Roberto Pando of MCS will then speak more specifically about how the results in Washington will impact our Medicaid and Medicare Advantage on the ground in Puerto Rico. MAPA member companies insure nearly 2 million people under the Medicaid and Medicare Advantage programs in Puerto Rico, but we are only one piece of the puzzle. We can only meet the needs of our stakeholders by working together with all of you, hospitals, providers, and the entire healthcare system. So we are particularly grateful to have you all here with us today. We look forward to partnering with you in the coming year to develop and implement comprehensive, long-term solutions that address the drastic underfunding of our federal healthcare programs on the island. Thank you again for joining us, and I hope you find the program informative. And with that, I'd like to welcome Andrew McKechnie to begin our federal elections update.
Thanks, Bobby, and thanks, Governor Fortuño and the other speakers. It's good to be here, and I think this is a great opportunity to share some of what we're seeing and get some questions and have some discussions. So looking forward to this program. I was given the task of talking a little bit about the incoming Biden administration and kind of how to think about that in regards to not only just nationally and globally, but also from a Puerto Rico standpoint. So we are now 37 days away, I think, from Joe Biden becoming the next president of the United States. I know our current president is still working through some of the emotions around that, but it does appear, based on some of the state votes today, that it is happening. The Electoral College votes are being certified, and the Congress will approve those later in the week, and I think it will be and has been a foregone conclusion. So I think, our position has been, when that became clear, was really to start to prepare for the incoming Biden administration. And I think it's important to think a little bit about what are they going to be taking on when they get the keys to the White House. I think from a healthcare standpoint, which is obviously where we focus the most, coronavirus is going to be issue number 1, 2, and 3. The first thing he announced was his COVID advisory task force. He is very, very focused on that. And I think every decision, every policy that Biden approaches will be done through the lens of how is the country doing with the pandemic? How is the pandemic affecting our economy? And so I really think if you have to ask kind of what are Biden's top 3 healthcare issues, it's coronavirus, and kind of everything comes forth to that. So I think we will continue to see a lot of personnel dedicated to that. We've already seen Vivek Murthy, who is the former Surgeon General, take on that role again, and he will once again be the Surgeon General, but also will be heading up the COVID response. And I think the advisory board will be very active. The ACA will also be a big focus for Biden. I mean, that was something that was done on his watch while he was vice president. So if I had to think about issue kind of number 4, it's going to be coverage. It's going to be protecting the ACA. I think he could easily make the case, and I'm going to be using his words here, not mine, but he could spend the next 6 to 9 months of his presidency cleaning up the wreckage that Donald Trump caused to the ACA, whether it's around short-term plans or public charge rule or other issues that have eroded kind of coverage in the ACA. So I could see that being a big area of focus for Biden. I think that was probably a big part of what prompted him to choose Javier Becerra to be HHS secretary. He was not, in his years in Congress, thought of as sort of a go-to healthcare guy, but he was very invested in healthcare in the ACA when it passed. He led the charge for the attorneys general who were defending the case, and so I think the incoming HHS secretary, who I do suspect will be confirmed, I think is really thought of as a protector of the ACA and someone to build on that. I think he's also someone he comes from one of the most diverse districts in Congress, and I think he'll be very sensitive to the needs of Puerto Rico from that standpoint, because he's seen it in his own district about how social determinants and some of those issues can really affect people's overall health. So I think Becerra will be a good ally for us at HHS, and I think we'll see more appointments in the coming weeks, and we'll be looking forward to working with them. And then, lastly, specifically to Puerto Rico, I will say Biden said all the right things during the campaign about Puerto Rico. Let's address Medicaid. Let's get Medicaid parity. Let's make sure we address Medicare Advantage. And I know Orlando and Roberto will talk about that in more detail later on. I think a little bit of the thinking has to be, we've seen this before, and we're looking forward to getting it right this time. Because I think during the Obama administration, we heard a lot of those same things about we're going to finally get Medicaid parity. And I think we're excited. I think the way to frame it is we're excited to get a second chance to get this right, and looking forward to working with the Biden administration to address Medicaid underfunding and getting some stable funding and some parity around Medicare Advantage. So I think there's a ton of opportunity. Like I said, he said all the right things on the campaign. I think he recognizes how important his relationship is with Puerto Rico and the Puerto Rican community. And so I think he will be very focused on that. But like I said, I think we're going to have a tough time just making sure we cut through and are sensitive to the fact that coronavirus will be issue number 1, 2, and 3, and that they will be very focused on the distribution of the vaccine. And I think we should be looking for opportunities to work with them on that issue as well as others. So I don't want to go too long, so I will stop there and happy to answer questions. I'm going to turn it over to my very esteemed colleague, Charlotte, to give a little bit of an overview of what's going on in the United States Senate.
Sure. And just listening to you talk, Andrew, it occurs to me as we sort of look back at the Trump administration and think about how the Biden administration could posture on Puerto Rico in particular, that we have had the kind of unfortunate last few years where I think when Republicans on the Hill have wanted to be helpful, really haven't had that partnership with the administration. In fact, I think they've had the opposite with the president who's been, very vocal about not spending any more money in Puerto Rico. And I think that situation can only improve. Oddly enough, I think, even for Republicans that have wanted to be helpful in this space, having a Democratic administration that wants to make it more of a priority will be very helpful. But just speaking to the Senate in particular, I think it's going to be an interesting couple of years for the Senate this next cycle because we have 12 Senate Democrats who are up and 21 Senate Republicans. So that's a whole lot of people in cycle who need to show some progress on some issues. I do think, and I know Governor Fortunio will talk more about this, but I think especially because of the very narrow majority in the House this next Congress for Speaker Pelosi, so much of what is going to happen on the healthcare front really has to be bipartisan. That was always true in the Senate, but I think it will be more true in the House, and I think that probably bodes well for how we achieve success in this space. And I think in particular, just thinking about kind of the last week or two, how this group of moderate Senate Democrats and Republicans were able to put together a bipartisan compromise on coronavirus and kind of get that going again. I think really it's illustrative that sort of the people in the middle are going to be really important because assuming the Senate Republicans hang on, which I think they probably will, and will keep the majority, they have a slimmer, very slim majority. And so I think it's this kind of group of people who are showing we have bipartisan problems that need bipartisan solutions, and we have to be able to work on them together, I think is going to be really key. I think you clearly have some folks in the Senate who would like to see the Senate do things other than judges. And, that's been, I just think from a healthcare perspective, it's been challenging to move much forward. That's in part because of the pandemic, but I think has a lot to do too with just sort of the posture and priorities of chairman and leadership. And I thought about the other day, if we hadn't had the pandemic, what would we have accomplished on the healthcare front this year? It would have been hard to see much of anything move forward. And again, I think that has to do with sort of very different views between the Hill and the White House and how to improve things like coverage and Medicaid. And those are really big problems that require a lot of leadership. And I think it's been lacking, right? And for the administration, I think in particular, to kind of improve some of these public health programs, improve some of the entitlement programs, that there are people that want to dig in on that. And I think we will see that at the committee level, but I think we'll also see that with sort of some of these off committee members who want to be more engaged in some of these problems. And I think too, just as we think about how to kind of engage in that, meeting people where they are, I think that this is something that in particular, we've done well as a group to think about, okay, Republicans want to hear about how investing in Medicaid in Puerto Rico, for example, will improve things overall, thus lead to less spending later, right? We've tried to come up with some, I think, creative messaging around that, but that's going to be especially important going into the next Congress. And just as Andrew said, when you think about kind of what is important to the Biden administration when it comes to healthcare and thinking about how It's coronavirus, probably items 1 through 10 or 1 through 20. It's no different for the Hill, right? And I think just thinking about what the agenda will be on the healthcare front and what committee chairmen and rankers want to do, they will probably be doing COVID legislating for the balance of next year and possibly many years that follow. But I think there will be room for other healthcare as well. I think some of those things will flow from the need to address things in the COVID space, because COVID has highlighted things like health disparities, right? People already cared about that as an issue, but I think it's really, there will be a lot of things that I think are left in the aftermath that people want to address in the healthcare space. Yeah, I'll pause there and I'll turn it over to you, Governor Fortunio, and then we can dig in on some of these things in a bit.
Thank you, Charlotte. Indeed, quite interesting that the Senate is expected to be very close in terms of seats. And the same thing is happening in the House. And in spite of the fact that Democrats were able to regain the White House, and as Andrew mentioned earlier, as we speak, actually, electors are voting in state capitals all over the country, electing the new president, President Joe Biden. In spite of all of that, Republicans did pretty well in the House. Actually, Republicans were able to regain most of the seats that they lost in 2 years before that. And as we speak, there are still some undecided House races. But as we speak, the Democrats are expected to hold the slimmest majority in the last almost century that they have held. You need 218 seats to hold a majority. At this moment, Democrats hold 222 and Republicans 211, but there are still, again, as I mentioned, some races that need to be actually decided, which means that actually both in the Senate, as Charlotte was mentioning, as well as in the House, bipartisanship will be the new mantra, and it will be required. And I actually, allow me to remind everyone that at the bottom of your screen, there is a Q&A button. And if you have any questions during the course of our presentation, you're actually invited to jot down your questions, whether in English or in Spanish, and we'll make sure that we try to address them before the end of this session. In terms of committee leadership, committee leadership that matters for healthcare issues for Puerto Rico, the most important committee will be the Energy and Commerce Committee, and actually Congressman Frank Pallone is expected to actually continue serving as that committee's chair. But Kathy McMorris Rogers from Washington State will become the ranking Republican. And why is this important? Actually, for two reasons. Number one, that as we mentioned earlier, there's a slim difference between the Democrats and Republicans, which means that both parties are likely to need each other. But secondly, actually, the same way that Charlotte was mentioning that 2 years from now, the election cycle on the Senate side will be challenging for Republicans, it is expected to be challenging for Democrats on the House side, which means that 2 years from now, Kathy McMorris Rogers may end up being the chair of that committee. So again, we need to work with both sides. Frank Pallone has been helpful on Puerto Rico issues in the past, specifically on healthcare issues. Kathy McMorris Rogers actually is someone that knows Puerto Rico and actually has been supportive of Puerto Rico causes in the past. She's close to Congresswoman Jennifer Gonzalez. Actually, Kathy McMorris Rogers and myself, we came into Congress together. So she's someone that understands Puerto Rico issues quite well. The other committee of jurisdiction is the Ways and Means Committee, and Richard Neal will continue to be chair, and Kevin Brady on the Republican side will continue to be actually someone that will be the Republican continue to serve as Republican ranking member. Neil, again, has been helpful to Puerto Rico in the past. And Kevin Brady actually happens to be someone that, we came together into Congress as well, someone that is not as familiar with Puerto Rico, but has been helpful in the past and offered to be helpful in the future. With that, what we need to know is how will all of this impact both the Medicaid and the Medicare programs in Puerto Rico? And I will leave you with Orlando Gonzalez Rivera, who will start discussing the Medicaid angle. Orlando?
Thank you, Governor. Good afternoon to everybody. Thanks for connecting. And I hope that this, session brings, and stimulate the discussion for these two important programs, Medicaid and Medicare, that, as you know, served more than 62% of the Puerto Ricans. So anything that happens in Congress and in the federal government does impact healthcare in Puerto Rico. So thank you to Andrew, Charlotte, and Governor Fortunio for that briefing of, the latest on DC. What I want to do is just spend a few minutes framing what's, the horizon looking for Medicaid, and I will think probably Q1 as the horizon. And because there's a lot that needs to happen in the next few months, and that comes on top of both a transition here and a transition in the States. So as you guys know, Puerto Rico was given at the end of last year, Puerto Rico was granted significant amounts of dollars, probably historical number, $5.7 billion for 2 years for the Medicaid program with a 76% FMAP. And those were, those fundings were based on some information that the Puerto Rico government presented Congress. And there were some programs that were presented. Unfortunately, Puerto Rico was not able to spend all the money. So, and this is important because, not because of the use of the money, that of course is very, very important, very relevant, because, those monies are needed to address disparities in care. And also the monies that are needed to increase compensation to providers. But to me, the most concerning part is the credibility. The credibility that might be impacted, because we presented something, we basically said that we need it, and unfortunately we were not able to use it. And there's multiple reasons for that. There were earthquakes, pandemics. I know FOMB was very concerned with approving some of the program because of the short-term nature of the funding. So there's multiple factors that impacted that. That's why it's important that, the new government, the new administration, and all of us together, we have to go at some point to Congress united and basically gain the credibility of Puerto Rico back. That funding is needed, as I said, for addressing the needs of, the most vulnerable population, and also to close the gap, in providers' compensation. Recently, the Federal Fiscal Board approved on a conditional basis the expansion of Medicaid. And that's something that the government is working very active. Actually, CMS just recently approved as well that expansion. So the government is running an initiative trying to go after members or potential people that can join the program. What I understand is they have a list of people that apply in the past, and because of income levels were not approved, those are going to be the main targets initially, to go after those people and trying to get those, to see if they still qualify under the new parameters and join Medicaid. They're talking about 200,000 people that might join Medicaid. And I think it's important that, we work together and support, as an industry, support the government, go after those beneficiaries and trying to see if they qualify, and of course, give them coverage. The issue that we have to all be aware is that, this is going to require some simultaneous effort. On one end, we're expanding Medicaid and enrolling people. On the other, we have to make sure that we go to Congress and ensure that after September 2021, those funds are going to be reassigned. Because if not, that's people that is going to have to be, eliminated from the program because of the conditional approval. It's approved until September of 2021. And of course, the continuity of care of that people could be impacted. So we need to work, with both hands. With one end, supporting what the government is doing to expand people, and with the other, making sure that we're gonna have the funding past September 2021. Because as we all know, it's not, we're facing another cliff. And, this seems to be like the same story every other year or every couple of years, Medicaid going again into another cliff. No exception, we're expecting a cliff in 2021. So that's definitely something that I am anticipating that is going to have active discussions in all sides of the government. And as an industry, we have done it in the past. We all need to go together and support and fight for this funding. The good news is, as you heard, there's a changing, or it seems there's going to be a changing administration in the federal government. Some people still saying that it's kind of a moving target, but definitely Biden looks at the new president. And the thing is that Biden did something very interesting that is good for Puerto Rico. And he makes some specific commitments and in the campaign. And actually, there is specific commitments on healthcare. And some of those commitments included, as Andrew said, expanding, ACA. But specifically on Puerto Rico, he said that he will increase, the level of funding, basically to have equal Medicaid and actually SSI benefits than other parts of the country. So that's very important. It's very relevant because he makes that commitment, and it's something that we can go against and and actually ask for action. Understanding on the flip side that the Senate is going to be controlled by the Republicans, as Charlotte said. So it's going to require both dealing with the executive and dealing with the Senate and the House to make this a reality. But definitely, it's good that we have that level of commitment. Also, Biden committed to increase funding for the community health centers that for Puerto Rico alone will represent over $100 million of additional funding to the health community centers, which is also additional funding for population that's needed. So definitely a lot of activities are foreseen on this first quarter in DC. And again, it's going to require a joint effort. I think, with the COVID, that definitely brings, a lot of opportunities. It's a crisis that we're all dealing with, but it's definitely going to bring opportunities. The federal government, as you heard, Andrew and others said, it's going to be priority number one, and we need to take advantage of that opportunity, basically to look for expansion of services. I think we need to work together to expand, telemedicine. Telemedicine is a tool that we can definitely, we should, encourage and pursue the connectivity, and also taking advantage of the interconnectivity requirements. We should work together to expand on that and make sure that Puerto Rico is at par when it comes to connectivity across all the provider sectors. And of course, facilitating vaccination and all preventative services, that's critical. The vaccination process is basically starting on the island. And I think we should all collaborate and make sure that we support that process. Also, another opportunity that we have to take into our use to our favor is the I don't know if it is perception or not, but there is a lot of people saying that the impact that Puerto Ricans had on the elections. I think that's something that at least when we go to Washington, we don't use in the past that actively, and I think it's something that we're probably going to have to emphasize as we look into the future. So definitely a lot in the horizon in the upcoming months, and on the flip side, I see and we see a lot of opportunities, but it will require us working together to make it happen. So with that, I'm going to pass it over to Roberto Pando, that is going to talk about the Medicare side.
Thank you, Orlando. Thank you, Bobby, and all the MAPA team for the opportunity. And thank you to those friends from IPAs, hospitals that are connected. And going to our usual tradition, I do want to take, hold on. Where is it? I do want to take the group back to some of our main points that we've been working with in Washington. If I can find the, oh, here we go. Can you see that, the slide? Does it show the pie charts? Perfect. Yes, so going back to our friends from IPAs and hospitals and the whole community in Puerto Rico that has been part of this effort for so many years, as we turn, to the MAPA efforts, you've many times heard us that we need to continue pushing, not pushing pushing for healthcare, all the federal programs, Medicare and Medicaid and Medicare Advantage. And I'm glad, as Orlando was pointing out, and this is where, as part of the work we do at the Medicare Policy Committee in MAPA, this is where we focus, right? Medicare Advantage, a program that has become honestly the big platform of healthcare in Puerto Rico. You've heard us say it many times, and it is, I think it is no surprise, it is no luck that Biden included increasing Medicare Advantage rates and asking HHS, asking Congress to work on Medicare Advantage rates in Puerto Rico, which are too low in his administration. And as we go through the process for MAPA, it's been crucial to make sure that we're pushing for both programs at the same time, understanding how vital Medicare Advantage has become for the island. What you have on the slide, you see the pie chart on the left. Typically, we show the membership. You already have over 600,000 people. Some of us, some of you in the IPAs and the hospitals that have seen in our community, that have seen this program evolve, and many, Orlando, all of us that have seen this program evolve for the last 15 years, 10, 15 years. Over 600,000 people in MA is enormous. It's by far the selected program by our seniors, by our disabled population. And not only that, it pays for 55% of healthcare services on the island. These are the elderly, the poor, the chronically ill. These are the highest users of our hospitals, the higher users of our specialists, of our physicians, and of our healthcare services in general. But having said that, and I hope when the Biden administration comes and talk, many in our team spoke about the ACA. Well, one thing we don't want returned from the ACA is obviously the MA cuts. We live through the MA cuts, all of us, including our friends, and the different components in the system. We lived through managing cuts that went over 20%. Starting 2012, and we've been able to turn the curve a little bit in the past administration, in the Trump administration, and we hope that Biden's commitment in his platform is a sign that that trend will stay. But certainly, it's really hard when it's really challenging when you can see that we're still 40%. The MA rates in Puerto Rico are still 40% below the U.S. average, 22% below the USVI. So this is not only about this is also about continuing our pursuit for fairness, our pursuit for closing the gap of benefits and the duals eligibles and the Medicare population, which will impact the health system in general. Having said that, I wanted to point out uh, what are the main points that we've been working in MAPA in relation to Medicare. And Orlando gave a good review from the Medicaid perspective. I want to point out several points that we've been working in detail at our committee, and that we have worked with our lobbying team and both in Congress and in CMS. So Biden, as everyone pointed out, emphasizes on COVID, everyone talking on COVID. Well, one topic from COVID that's critical for Puerto Rico and for MA is risk scores. Many of you that have learned about the MA program know that in order to get the appropriate payment from CMS, we need to make sure that diagnoses are documented. And the COVID-19 situation in Puerto Rico has been critical since the governor started right with the strict lockdown back in March. Certainly, one thing that's been discussed nationally, but more so in Puerto Rico with the strictness of those lockdowns, is the fact that we're going to have a lot less evidence of the diagnosis of the risk profile of our population, which is critical to get the reimbursement needed, the payment needed in 2021. So at a national level, you hear 5-6% potential reductions in MA plan payments at a national level from this factor. There are specific proposals that AHIP and others are pushing, and that includes MAPA, to try to mitigate this impact, and that we hope that the current administration, as it transitions into a new administration, is able to address. We really need the risk profile of the Medicare Advantage members to be supported, maybe looking back 2 or 3 years in the claims, in the health risk assessments, to be able to evidence the risk scores. And we have other technical proposals that are critical for Puerto Rico to get the payments, the funding that are needed to cover for 2021 benefits. Having said that, another key topic is Medicaid funds. As Orlando pointed out, one big part of Medicaid funds is the dual eligibles. Unfortunately, out of the 5 proposals that the Puerto Rico government was able to push to get incremental dollars in Congress, only one that pertains to the dual labels has not been able, still pending, to address some of the deficiencies in benefits and support for the dual eligible program, which is commonly known as Medicare Platino. The proposal that was included in the Medicaid funding was to cover the Part B member premium, but there are other ideas related to the Platino wrap payment and the use of Medicaid fundings for the duals that are executable, and that we've been working with the government, trying to transmit to ASES and the Department of Health to be able to get it done. And by doing that, connect with what Orlando was pointing out, the credibility that we need to assure, that we need to demonstrate. If we get incremental funds to close gaps in benefits, to work with our population, our complete Medicaid population, we need to deliver. And that delivery, that performance is what's going to allow Puerto Rico to continue working for the next cliff and bring us closer to parity with regards to how citizens are treated in the States. As a third point, I would say, and you've probably heard, this is part of the whole political dynamic that has occurred with the elections. CMS and HHS, many of you actually helped us, have helped us in many years, signing community letters, asking for HHS, CMS to take action on MA rates. And every year we have to go through the process to protect what is probably over 20% of the funding that we get in MA right now is dependent upon the fixes that we've gotten, fixes that come up in the CMS rule all the time. So we need to stress that these fixes need to be maintained, and we need to take steps further. As we do that, the calendar this year, the Republican administration actually accelerated the process for the rate setting of MA of 2022. The advance notice, as many of you recognize, was actually issued already now in November, and the rates are expected to be released before inauguration, because before the new administration comes in January 20th. So we're currently actively pushing with the transitions teams, with the staffers, with everybody. We need MA fixes to be maintained for Puerto Rico for 2022. This is what's allowing our healthcare system to manage through this whole situation. This is what's allowing us to support the whole infrastructure and the platform in general with all the providers. And as I said, 55% of all healthcare is supported by the MA program right now. Fourthly, the actions in Congress. The Biden administration proposes the Part D low-income subsidy. We also have a specific proposal called PRIMA that Resident Commissioner Jennifer Gonzalez has always been a big proponent of PRIMA. It mandates the increment in Medicare Advantage payments to be used for provider payments. So it's something that we've worked through consensus with the community, with many of you. So it's something that we are also prioritizing as we move forward. So as I said, I would say there are 3 main elements as we bridge or we connect between the political scenario of a new Biden administration and Medicare in Puerto Rico, which is healthcare in Puerto Rico in a lot of ways. One, COVID, protect from COVID acknowledge that we don't have the diagnosis to actually get the proper payments in 2021. MAPA is active on that. Second, Medicaid funds, we cannot leave them unused, and we cannot leave the dual eligibles, which have a lot of gaps in benefits, which are the elderly and the most frail, untouched by the new increments in Medicaid funding. And thirdly, Medicare Advantage, both administrative and congressional fixes are priorities that we're hopeful that the Biden, with the Biden commitment in his platform, they'll be addressed. Now, having said that, we've been through administrations that promise and don't deliver, to be honest. So I think our job as a community is to actually push out there and make sure that the word is put into action, this time at the federal level by the new administration. I'll leave it there.
Thank you, Roberto. And why don't we start addressing the questions that you have been sending to us? And Charlotte, the first question, I'd like to have you address it. And the first question is, if Republicans hold the Senate and we face a split 117th Congress, is there any concern that we may see governmental gridlock that would slow our efforts? You're muted, Charlotte.
Sorry about that. Yeah, so I think certainly yes, if there's a divided Congress, is there gridlock? Almost by definition, there will be some. But this is where I kind of go back to, I think just thinking about just sort of ways where we've seen if one party controls everything, do they have the ability to get things done faster? Sort of, yeah. And then they have things like reconciliation they can use, but we still have a 60 vote threshold in the Senate for mostly everything anyway. So things kind of have to be bipartisan to get through the Senate, right? So I guess it's probably going to be the case that we will have a Republican Senate and a Democratic House. I don't know that that dramatically changes the way healthcare legislation would have moved forward outside of potentially the ability for, if the Democrats had swept, the ability to use reconciliation. But a lot of COVID legislating wouldn't have happened by reconciliation anyway. And I think when I think of sort of, again, what the balance of next year may look like, and possibly for the next few years, we're not going to have just one big ACA style bill that would move through both chambers. We would have probably several regular bites at the apple here on the healthcare front. Where we, I think, have sort of found ourselves before is in health extenders packages, right? When we try to argue for some of the things that are on our list of priorities. That's not going to change. We probably are still going to have, a regular conversation about health extenders and other healthcare legislation, either related to extenders packages or COVID. So I think the some amount of gridlock, of course, will exist, but this is why I kind of go back to this bipartisan group of senators who want to see things happen, the actual necessity of needing to make sure things are bipartisan to move through the Senate anyway, kind of with or without divided government. So I don't see it as I don't see it as something that is not overcomable for us in particular, because we always needed to have bipartisanship around this issue. And I think even in a scenario where Dems had swept, it wasn't clear that they would be able to get the wish list on Puerto Rico out of the Senate. Again, even if Democrats controlled the Senate, because you would still have some Republicans that have to agree to it. So I think what it reminds us of is we need to posture our solutions, posture ourselves when it comes to our solutions in a bipartisan way. And this is why I said earlier, kind of meet people where they are, figure out the message that works for Republicans, figure out the message that works for Democrats, and have kind of a dual track around that. Because the same thing isn't going to work for both. And we have to just keep trying to perfect that. But I'll pause there. Hopefully that answered the question.
Yes, thank you, Charlotte. I have a question for Andrew now. Andrew, a couple of our panelists have alluded to the commitments that President-elect Biden made during the campaign vis-a-vis Puerto Rico on healthcare issues. What is the likelihood that the Biden administration will be able to deliver on its commitments on healthcare issues? That's number one. And number two, in delivering, some of this may be regulatory in nature and will be within the exclusive purview of the executive branch, but some of it will require legislation. Do you see any major stumbling blocks? And as one of them, the fact that you may recall last December, Puerto Rico received all this additional Medicaid funding and not all of it has been used. Is that going to be a problem, when we go to Washington to address some of these issues? Is that affecting our credibility in a terrible way or not necessarily?
Yeah, a lot there. So I'll try and keep it brief. Your question would seem to indicate that sometimes politicians say things on the campaign trail that they can't actually deliver, which I can't believe you would think that, but we'll set that aside. Look, I trust Joe Biden's words that he has every intention to work towards getting parity for Puerto Rico's Medicaid program and improving Medicare Advantage rates on the island. That being said, and I think this actually kind of runs directly into what Charlotte was talking about, unless you have support from, Obama wanted to provide parity for Medicaid in Puerto Rico, but when the price tag came in at $35 billion, it was very challenging to figure out how do you pass something like that, especially when we're already sort of having trouble paying for the entitlements we currently have. So, I think he has every intention of doing it. I think we have to push for it. I think we have to look for opportunities. You have a Marco Rubio up for re-election in 2022. You have Rick Scott, who's been helpful in Puerto Rico, who's head of the senatorial committee to get members reelected. You'll have an open Senate seat in Pennsylvania, so where there's a lot of Puerto Ricans in certain parts of Pennsylvania. So I think there are political opportunities to move the ball forward with Republicans. So I think we have to look for those. But I think he has every intention. I do think we'll probably, we'll want to try and pass a big Medicaid bill, but I think you made a very good point that we also need to focus on the regulatory opportunities, because that is where Biden will have the most flexibility, the most ability to operate without running into Republican opposition. Look, the challenge also is going to be Republicans have signed off on Trump spending trillions of dollars without question for months and years now. That's going to change. They're going to find some level of fiscal responsibility now. So I think that makes it very difficult to see the big deals coming together. But I think, on the Medicare Advantage front, there is a lot you could do to help Puerto Rico regulatorily. So I think that is an opportunity where we should sit down with the Biden administration and see how we can work together to achieve some of those mutual objectives.
And do you, Andrew or Charlotte, see that the fact that Puerto Rico has not fully utilized the additional Medicaid funding that was appropriated last December as an issue that will haunt us when we go back to request additional funding?
Yeah, sorry, I forgot. And Charlotte, you should weigh in here too. I do think, look, I think we have a challenge there with that. I do think some staff felt a little burned on it just because they got updated very late on the problem. I think it kind of came as a surprise to them. But, I think they also, they realize they want to be helpful here. They don't want to appropriate money and then find it not available to the island. So I think one of our goals needs to work collectively with Congress to make the case to the FOMB that this money is needed, that this money is coming, that even if it is done in 2, 3, 4 year tranches, every intention is to keep the money going. So it's going to be a challenge, but I think it's something that we have some opportunity to work with Congress on. I don't know, Charlotte, if you agree.
Yeah, I think that's right. I think it matters a lot what the narrative is around why it's unused, right? And as Andrew said, making sure people aren't surprised by that and being upfront about kind of what's happening, because it's also the case, as we've seen in the past, they don't want us to spend it too quickly, right? It's like if we go through it too quickly, they're like, well, you burned through your money. What happened here? So it's a fine line, I think, of they want us to be using it the appropriate amount of time, the appropriate way, and sure, that's ideal, but we're not the only people this happens to where exactly what was appropriated isn't used in the timeline that people think it is. So I think it's, again, not a problem that's overcomable. I do think there is, though, we have to have the right story to tell about that and be able to explain it. So.
And Charlotte, one more question. It seems like Congress, when it addresses Puerto Rico healthcare issues, does so in 2-year tranches, as opposed to more mid or long term. Do you believe that actually, number one, that there is a possibility this coming year with the new scenario in Washington for at least a midterm address, a way of addressing some of these issues that was already mentioned by Orlando of the Medicaid cliff? Is that something that's doable, number one? And number two, do we see more possibilities for action on the MA front, Medicaid front, or both next year?
So yeah, on the first part of the question, I think part of the reason for the 2-year cycle had to do with the way other Medicaid and public health programs were funded for a while, right? Was the CHIP reauthorization was on sort of a 2-year cycle for a while. I don't think that Puerto Rico has to be, but I do think it's incumbent upon us to make the argument for why it makes sense for it to be longer, other than, everyone prefers longer, but do we have a substantive reason? And I'm thinking just too, what a message could be that would work on the Republican side of the aisle on, more continuity of funding allows less spending over the long term, right? Or more responsible spending, or whatever the thing is, that we have kind of a fiscal conservative argument to make around longer is better for reasons that it will involve kind of better planning, which allow us to make sure our dollars are used in a targeted way. But I think it will matter in terms of what our opportunity is there, what kind of other healthcare stuff is happening, how long that's for. As we've seen in this end of year health extenders package right now, there are a variety of deadlines, or we could end up with a variety of deadlines, some things being 1 year, some things being 2 years. It will be hard for us to ever advocate for more time, I think, than the longest other thing that's being done. If nothing else is being done for longer than 2 years, us being the thing that gets done for 5 years, I think is hard. But I think if there are other things happening for longer periods of time, we should certainly be one of those things. So I think the opportunity exists, but I think it matters what else people are thinking on how long cycles of funding are going for other healthcare related priorities. On the second question, which was, is Medicaid or MA more likely to be a legislative issue next year? Was that right, Governor? Okay, so
Yes.
I think I tend to think that Medicaid is sort of the hot issue because of COVID. And when it comes to sort of next Congress, what people could prioritize, and just thinking about especially a Democratic House and a Democratic administration, I think there will be a real push to address some of the shortfalls in Medicaid, because COVID is going to leave the Medicaid population worse off, right? I think we've seen that very clearly from all the data around low income and health disparities and all of it. So it's hard for me to see how that's not a priority. Kind of above MA, I do think MA offers a lot of bipartisan opportunity. Just when we think about, the MA program is important to Senator Schumer and Richie Neal, and we have a lot of champions, I think, when it comes to thinking about MA and how to improve MA. But I think just broadly, where the crisis has left us, where the pandemic has left us, hard for me not to see how Medicaid won't be kind of a key area of focus for Congress. And look, that doesn't mean, I don't think that means Senate Republicans are going to jump on board and be really excited to expand Medicaid spending. But I do think that's where the opportunity, I think, and the challenge is for us is to make sure that we fit into that narrative.
Thank you, Charlotte. We have one more question that I'll try to address quickly and then pass the baton over to Bobby to close our program today. The question has to do with the certiorari petition to the U.S. Supreme Court on the Court of Appeals, First Circuit Court of Appeals decision upholding the U.S. District Court decision on the Baello Madero case, which actually will allow about 300,000 residents of the island to participate in the SSI program. Already last week, the chairman of the U.S. Natural Resources Committee, Grijalva, sent a letter to the Biden transition team and the president-elect, among other things, asking for him to instruct the Solicitor General once he is sworn in on January 20th to actually withdraw the petition for certiorari. We'll see what happens there. With that, we thank you all for participating today, and we want to ask Bobby Garcia, President of MMAPA, to share with us some closing remarks.
Thank you, Governor Fortunio. Thank you to all. I think it was a very interesting conversation. A lot of interesting points that were brought to the table. And I just have a minute or two. Pardon, we are just a few minutes beyond our timeline. But I think we're in a unique juncture. We are facing as a nation the greatest public health crisis in the last 100 years. Not surprising, healthcare and the economy were the top two issues for the electors on both sides of the aisle. And we had two presidential candidates that presented, I would say, diametrically opposed views of how to address these issues. But they both realized the importance of Puerto Rico and the Hispanic population more broadly to the outcome of the election. And both made specific commitments to help Puerto Rico overcome its dual and longstanding health and economic crises. So, we heard some very interesting points on what the priorities will be for the Biden administration, what the dynamics of the Congress will allow us and anyone else to really achieve, especially in the healthcare space. So when we think about these two items, healthcare policy and the Puerto Rico agenda, we understand clearly that COVID and protecting, beyond COVID, right, protecting coverage and restoring the Affordable Care Act will be a top priority. That means for us, we need to make sure that as an industry, as the healthcare industry in Puerto Rico, that we work together on the vaccine, right, and how to administer and deploy the vaccine and support the Puerto Rico government in that respect, and also send a message to Congress and Washington more generally that we are doing it right. I think that's a very important message for us to carry to Washington. I'd say not coincidentally, MMAPA was created in 2009 when the Affordable Care Act was being adopted, and that was kind of the genesis of MMAPA. So we have a really interesting opportunity to make sure that as the Affordable Care Act is looked at yet again through different lenses in Washington, that we make sure that Puerto Rico is considered, given its reality, the way it was done, 11 years ago. With respect to the Puerto Rico agenda, specifically, I think Andrew summarized it well. We've heard these commitments before. So, if we want to be blunt, we can ask the question, what will be different this time? Maybe more politely would say, how can we continue to build on what's been accomplished and make sure we get it right? Importantly, in the new political environment, we've heard it from several of the panelists, that moderates will have the upper hand if we want to get anything done. So compromise and bipartisan efforts will be necessary. And we are competing with many national issues. We're competing for many national issues for attention, still in the midst of COVID and with a hugely increasing federal deficit. So planning ahead, which means that what's the call for action for all of us that are here today, and how we continue to build a common agenda for our industry as we go jointly to DC. First thing is we need to be very strategic in our approach. to DC. We heard that throughout the afternoon, and speak with a single voice. We always want to seek for permanent solution, but that may be too ambitious at this time. So at least we want to secure longer term funding for Medicaid and continue to close the gap in the MA benchmark. We need to do that understanding that the Republican Democratic parties will have very different approaches. So we need to have a dual track on the messaging, but making sure that we understand that dynamic that I think, Charlotte, you captured very well, and that moderates will have the upper hand, and therefore we have to speak their language, which is one of compromise. I would say, so that's number one, is let's reactivate a coalition so we can go together with a single voice to DC and do it with a very strategic approach, given this unique environment we're living in and the new political dynamic. And second is, I'd say we should reactivate the seat, right? Forcefully ask for the HHS Puerto Rico Healthcare Task Force that existed in the prior time that it be reactivated with that understanding and unique focus on the unique reality of Puerto Rico. But we can't, be the purple elephant, right? We can't go in there and say Puerto Rico's different. You need to treat us in the way we need to be treated. It's be able to take the message of how Puerto Rico in many respects is the canary in the coal mine, as we've heard from Rick Shinto many times. We're the harbinger in many respects for what's going to be happening in the rest of the nation because of the high penetration of Medicare Advantage, the high number of duals, the fact that we are a unique space of mostly Hispanic population that we can innovate. And so we should be asking the government of the United States, HHS, CMS, and anyone else who's willing to listen, that we have a unique opportunity with some additional funding to make a real impact in the way healthcare is delivered. And that given this environment with the interoperability mandate that's around the corner, with everything that we know can get done if we work together as an industry, that we can show the US that we're not the problem child, but rather a path forward for the rest of the nation. I think that's the message we need to continue to carry forward through MAPA and through all the other associations together through a coalition. So that took a little longer than I would have liked, but I want to thank you all again for having participated. I hope this is the beginning of many interesting dialogues around these issues. I think in January, early February at the latest, we should have a much clearer picture of the realm of the possible, so that we can then start developing a strategy to work together and start activating our relationships and messaging in the federal capital. So with that, thank you all again. I don't know, Governor Fortunio, anything else that you think or anyone else we need to get out on the table?
Thank you.
All right, well, thank you, everyone. Talk to you soon.